Let's talk white spot lesions. I want to thank Colteen, Oral Arts, and Romero Dental Seminars for sponsoring these webinars and allowing us to provide one free CE credit after the completion of your quiz. We also want to remind our followers to visit our YouTube channel, Romero Dental Seminars, and please make sure to hit your subscribe button so that you can get automatic notifications every time we upload a new video. Our learning objectives for today: after viewing this webinar, the participants should be able to understand the etiology of white spot lesions, interpret the tooth surface fluorosis index, and be able to apply different treatment protocols clinically. The first thing that I want to share with you is, why do we get these white spots? And again, generally, enamel discoloration can be seen in form of dental fluorosis, opacity, and white spot lesions. Now, these are all different white spot lesions, different type of lesions, and we have to know how to differentiate them. Now, the ones I'm going to share with you clinically, a couple of cases, so that you can kind of figure out how do we go about treating these white spot lesions. But the most important thing is that the fluorosis is a white to yellowish color lesion that is not completely distinguishable, fused with normal enamel and symmetrically distributed. So this is important. You're going to see that fluorosis, which is one of the main lesions that I have seen in my practice, it can be all white. It could be a large white spot on either central or lateral incisor, sometimes even on canines. But you can also see in these lesions some staining, yellow staining, some pitted enamel, some irregular enamel, and you can see that they're very, very opaque, which obviously makes you understand why the depth of these lesions. These are fairly deep. The more opaque they are, the deeper you can tell that they will be once you start working on removing these white spot lesions. Now, other opacities that are not fluoride related have more specific shapes and differ from tooth enamel and are often found in middle teeth or in the middle of the tooth, like a central incisor or a lateral incisor. The other type of white spot lesions that we encounter clinically are the ones that are post-orthodontic treatment that our patients bring to our offices post-orthodontic treatment. This white spot lesion often occurs beneath broken bands, around bracket bases, and regions where brushing is difficult. Now, there's a reason for this, because obviously you will see that around these different orthodontic appliances, you will have a lot of plaque buildup, and this plaque is very acidic. So this acid in the plaque is going to demineralize the enamel, and you're going to get a white spot lesion. The difference between this white spot lesion and the non-fluoride related opacities that also are stained white is regarding the mineralized content of these white spot lesions. As you know, when biofilm is the one that creates demineralization, initially you're going to see this white spot being opaque, meaning that they don't shine. They're not mineralized. They're actually demineralized areas of enamel. Now, often this acid attack around these brackets due to the biofilm is something that is only transient, and because it's transient, these white spots then remineralize and become shiny. So orthodontic white spots after removal of orthodontic braces normally are already remineralized, and you can see them as being white shiny spots. But again, the idea is that you understand that these white spots come from, have different etiologies, but they're all going to be in one way or another treated in the same way. And I'm going to share with you the way that I treat them, combining multiple dental philosophies of care. But the most important thing again is to, make sure that you diagnose and that you know, you are certain of why these white spots are present, if they are related to fluoride, if they're non-fluoride white spots, or are they a derivative of orthodontic, post-orthodontic treatment. And again, just to show you a quick overview of this, you can see the white spots, the fluorosis, the trauma, the molar incisal hypomineralization that also has a white spot as a lesion. And you can see initially you want to diagnose them, and then you're going to treat them. And there's multiple ways of treating them. You can either do micro-abrasion, sandblasting, and micro-abrasion. You can do macro-abrasion, which is using diamond burrs. I rarely use that technique, but you can also use icon. Now, again, you have to be very specific. Icon is a resin infiltration, but you have to be, in my mind, there's always the best way to treating them is always going to be a combination of all these clinical options. I, in some cases, combine microabrasion with resin infiltration, or bleaching with microabrasion, or bleaching with resin infiltration. And again, it really depends on the case. It really depends on the severity of the case. And for that, the easiest way of understanding things is through clinical case reviews. So here I want to share with you a very nice case that we completed with Dr. Jackie Jansen when she was one of my residents at the Dental College of Georgia. She had this very nice case. You can see this young man presented to the clinic. He came through because of another reason. He was missing some teeth due to a trauma, due to an accident. But while we were, trying to restore these mandibular incisors, we noted that the maxillary incisors had these white stains in the incisal third. And again, this is considered a fluorosis lesion. So this patient was diagnosed with dental fluorosis. And again, dental fluorosis has to be not only diagnosed, but also classified. And the reason why we wanted to take it, we wanted to control this or eliminate them, or either keep them if the patient was okay with, having his teeth with these white spots, as you can see on the photo, was because we were going to restore with an implant prosthodontic treatment. His mandibular incisors were the ones that were avulsed during the trauma. So if he wanted these teeth to be restored without any white spots, it was important for us to make sure that we took care of this in his upper maxillary incisors and canines. So as you can see, the white spots are there. The most important thing is, classify these white spot lesions, due to fluorosis. And as you can see, Horowitz in 1984, he came up with this scale, which is called the Tooth Surface Fluorosis Index Scale. And the scale has 7 levels, 0 being no fluorosis, and 7 being the worst, the worst pitting and staining white, yellow, brown of the teeth. But the most important thing in my clinical experience, we've gone between 2, 3, and 4. Those are the cases that I have seen. I remember having also one case with one of my residents where the patient was probably in the 5 or 6 area with pitting and staining. But for the case that I just showed you right now, again, there was only white spots. And the way that I understand or that I analyze these tooth surface fluorosis index is really, I try to do it very simplified. If there's white spots, or are these white spots combined with some staining? And again, this patient didn't have any staining. There were only white spots. So you're only going to be looking at TSFI between 1 and 3, because anything beyond 3, again, number 4, you can see that already has an enamel staining in addition to any of the above, or in addition to any of the white spots. In this particular patient, he had white area at least 1/3, but less than 2/3 of the tooth, and it's very specific. So he was classified as a TSFI number 2. So that's how we classified him. And again, because these were small, these were not that opaque, they were localized in the incisal third of the teeth, we decided to move forward with micro-abrasion. And here it is. Once you place a rubber dam and the teeth dehydrate, you can see how noticeable now these white spots due to fluorosis become. And this is the reason why we wanted to make sure that the patient understood that, we could treat this or we can leave them the way they were. But if we left them, we needed to make sure that in our restorations on the mandibular incisors, we wanted to add some of this characterization just to make everything blend in well. But the patient did not want to have these white spots once he was made aware of them. And once he saw them on these photos with rubber dam isolation, as you can see, because of dehydration, they really, really show up much more on these photos. So again, initially we did micro abrasion Sometimes for these patients, what I normally do is I also give them a bleaching tray, and I do this before microabrasion. And the reason why I do this is because once you start bleaching the teeth and you increase the value of the teeth, then sometimes the white spots, some of them disappear, some of them may still be there, but are smaller in size. So there's less that you need to remove with the microabrasion, or even if you're going to do resin infiltration. But in this particular case, we decided to first go ahead and just eliminate, try to eliminate as much as we could these white spots using a microabrasion. And the product that we use is made by Ultradent. There's, I think, a couple of companies that still make this product to use in clinic. This one is specifically is made by Ultradent. It's called Opal Luster. And what I like about it is that it's very, the color of it is it's purple, so it's very noticeable. It's very easy to see. It also has some carbide particles and has a very nice special cup that has very stiff bristles, so that you have also some mechanical removal of the enamel and the white spot at the same time if you're having chemical removal of the enamel, right? So you are going to eliminate maybe, I would say, 40 to 70 microns of enamel, depending on how many applications you do of this product. This treatment is done under with no anesthetic, so it's only rubber dam isolation, and then directly we apply a 2 millimeter, approximately 2 millimeter circumference of the product on each tooth. And then once it's applied, we're going to use that opal cup, which is again a cup that has very stiff bristles inside, which helps you with some mechanical removal of that superficial enamel layer at the same time that you're trying to accomplish the chemical removal of the enamel in the ranges that I already shared with you. And as you can see, after a couple of applications, the white spots are almost gone completely. And I think that for this patient, we did maybe 3 or 4 applications. And again, this is done without anesthetic. So you know that if you're thinning the enamel excessively, even though in the incisal third you have very little dentin there, but if they would be in the middle third or in the cervical third, you're going to thin out the enamel, and as the closer you get to the dentin, the more sensitive this could become. I have never had a patient report excessive sensitivity while we were doing this, but they do feel a little bit of sensitivity maybe after the third or fourth application. And what that tells us is that we've already thinned the enamel. We've thinned the enamel to the point that we're getting near the dentin, and we want to try to stop at that point. One of the beauties of this treatment also is that you get something called the abrasion effect, which is literally a very shiny enamel, very luster enamel that you accomplish after using these type of products with these opal cups on top of these, around these teeth with a little bit of pressure. Again, you don't want to put a lot of pressure. You don't want to stay in one spot a long time. You want to go around the tooth, going cervically, mesial, distal, incisally, so that you can create this abrasion effect all around the tooth while eliminating the white spots. And at the same time, you want to do mild on and off pressure because you don't want to create heat. Again, you don't want to create any sensitivity for the patient. So just mild pressure, I would say, on and off, 30 to 40 seconds per tooth. You rinse, you dry, you look at the tooth, and then you decide, is there a need for a second application? And again, normally there's a need for 2 to 3 applications. I have had cases maybe with 4 applications, but it all depends on the size of the lesion, on the depth of the lesion, and again on the sensitivity or no sensitivity of the patient. This is 2 weeks post microabrasion. As you can see, he still has a little bit of white spots here and there, but we were able to remove, I would say, 80% of the white spots in that incisal third area of the teeth. And after this, we were going to give the patient a bleaching tray with 10% carbamide peroxide. And this is 2 weeks post bleaching using 10% carbamide peroxide. Again, beautiful, beautiful result obtained by Dr. Jansen in this case. Beautiful photography as well. So I want to thank her for sharing this case with me. But the beauty of this is that it's very, very conservative treatment. The patient, no need for anesthetic, no need for burrs. He had beautiful teeth. All we were doing is just making his teeth even nicer. We were making them, we were eliminating all those white spots and just making them much brighter, increasing the value through bleaching. So for this particular case, our protocol was microabrasion followed by bleaching with 10% carbamide peroxide, which is the only bleaching treatment that I normally perform. I don't use any higher concentrations because it's really not needed. 2 weeks later, you can see the results, and the patient was extremely happy. You can see a side-by-side comparison of the preoperative and the postoperative smile. he was, very, very happy with the outcome. And then we were able to, match the shade and no spots and the value when we were doing his mandibular incisors after implant therapy. Another case that I wanted to share with you. This is a little bit more, staining. You can see the white spots, how opaque they are. That immediately tells you a little bit about the thickness of this white spot. I don't feel confident when I have these yellow white spots. This is just me and my recommendation. I don't feel confident going in and doing resin infiltration for a case like this. I would always start with micro-abrasion because it's also a very conservative treatment. But I know that I'm going to eliminate the yellow, the brown, and the white, and then whatever white is left after that, then I think about doing resin infiltration if needed, or if the patient desires to remove completely the white spot. That's really the ultimate goal. It's not always something that you can accomplish, and that's something that you have to let the patient know from the beginning. This particular case, this was done with one of my dental students, Dr. Dean, who is an endodontist today. This was when he was, I think, in his second or third year of dental school. So we have this patient with dental fluorosis. Again, the first thing that we're going to do, we know that we've already decided. We looked at the medical issue. We knew what the causing factor was. We knew that it was high content fluoride treatment that was done for this patient when she was young. And we also, all we needed to do now is to classify this. Now, treatment options for this are, they may be multiple treatment options. You can, again, like I said before, you can use micro-abrasion, which is just a diamond burr, remove the white spot. But at this size and this depth, you're definitely going to be creating a depression on the enamel, and you're going to have to restore with composite. Once you restore with composite, this patient is forever going to be attached to that treatment, and you're going to have to either repolish or redo these restorations in the future. So for me, the most conservative way and the smartest way to do this would be with microabrasion initially, and then see how it goes. So that's what we did. We classified her case, again, using the same table that I shared with you initially, and we were able to classify her as a TSFI number 4, because you see now you not only have the white spots, but you also have now some staining. But there is no pitting of the enamel, which would take her to either a 5 or a 6. So once you start seeing those irregular pitting or lines, horizontal lines on the enamel, you know that you are at a higher index of fluorosis. So for her, again, TSFI 4. This is immediately after Dr. Dean went ahead and did, I think, 4 or 5 passages of the slurry of hydrochloric acid, which is what it's contained within this the upper luster product. So once you do that, you can see that he did multiple passes. Again, slight, light pressure, circumferential rubbing of the material around the tooth. You want to go up to the middle third, gingival third, and again down to the incisal third. You don't want to stay in one spot constantly, because you're going to create a depression there. You want to make sure that you get even removal of the enamel. And again, initially, you're going to get this translucent enamel. You can see how translucent the enamel is on the middle and incisal third. You don't see any of the white spots left after this first application. And again, this is immediately after. Now, 1 week later, once the teeth rehydrate, you can see that we got some of the white spots back. This tells you how deep these white spots were in this area of the tooth. And at this point, we ask the patient, is this something that still bothers her? Yes or no. In this particular case, the patient was really happy with the outcome. She was not worried about having these smaller white spots. We then went ahead and did bleaching for her. With bleaching, we were able to reduce the white spots a little bit more. This is 2 weeks post-treatment, and again, we're just waiting and following up the case. You can see that there's still a little bit of the white spots there, but if you compare that to where we started, you can see that there's a big difference. And again, a combination of microabrasion and bleaching, 10% carbon peroxide. This is after bleaching. You can see that we've increased the value of teeth, but also look at the white spots. They're a lot smaller than just after the microabrasion. So bleaching does help because it increases the value of teeth, and with this, you're gonna mask a little bit of the white spot. At this point, the only other option that we had was a resin infiltration, but the patient did not want to go through with it. This would have been probably the 100% solution. We would probably been able to eliminate completely the white spot, but as seen in this case, it's not only using one specific clinical procedure. You have to combine multiple of them. And my recommendation, my clinical experience after doing this for many, many years, is always to start with the microabrasion, then followed by bleaching, depending on the size of the white spot. If the white spot is not that big, you may even want to start with bleaching first, 10% carbamide peroxide for a couple of weeks, see how it comes out, see what increased value you get. And then after that, you can either do resin infiltration if the spot is very small, or microabrasion if it's a medium to large size spot. If you have a large white spot to begin with, you probably want to start out with the microabrasion, followed by the bleaching, and finally the resin infiltration if needed. Those would be the steps. And again, it all depends on the patient and what they, what they're looking for as the outcome. This is the same patient 8 months later, or 8 months after treatment. You can see a little bit of the white spots still remaining there, just as immediately after bleaching, but no more of the yellow spots. The enamel now looks a lot natural. You can see that abrasion effect, how shiny that enamel is, how smooth and it appears to be, and how shiny it is. And that's just the effect of using this product and going with these very stiff bristles and removing those small, very minor irregularities on the enamel. Now, what cases are the ones that I'm going to go ahead and do resin infiltration? And as I was saying before, I'm going to look at the size of the white spots in order for me to make this decision. And in this particular case, I want you to look at the photo on the right hand side. You can see that she had white spots on the number 8 and number 9. Number 8 was very small. Number 9 was even smaller. So these were very small white spots. They didn't seem to be that opaque. I'm going to show you a closer look. You see, they don't seem to be that opaque. So if they're not that opaque, in my mind, they're not as deep. And if they're not as deep, resin infiltration, it is the indication. The patient had already bleached her teeth on her own. So when she came to me, she had very light teeth. So the bleaching wasn't going to do anything for her. So I knew that the next thing that I would do was think about microabrasion or resin infiltration. How did I make the decision here? Again, the opacity of the white spot. In this particular case, it wasn't that opaque. This most likely may have been some white spot left after orthodontic treatment. And again, these are common white spots seen on patients after orthodontic treatment. They were small, they were not that opaque. In my mind, these are lesions that can be treated without any reservations with resin infiltration. And here is where I'm going to use that technique. In this particular, I like using rubber dam, but in this particular case, I decided to use these lip retractors made by Ivoclar, Optogard, and once everything was retracted, just because they were very small, I had good control of the area. I went ahead and started doing my resin infiltration using that hydrochloric acid gel that comes in this kit, and you leave it there for a couple of minutes. And you just follow the manufacturer instruction. A couple of minutes there. The idea is that this etching is going to penetrate through that white spot, and again, you can see that it's very localized. Etching. This etching is very thick, so it stays there. It's not runny. It's very localized. It's actually right on top of the white spot. You can see that I've selected 2 drops, different sizes depending on the size of the white spot. Leave it there for a couple of minutes. Rinse and dry. Apply the Icon Dry, which is alcohol. You apply it on top of the white lesion. The idea of this is that you're going to eliminate all the water that is in those enamel prismas that are etched at this point, and they're deeply etched. And the other goal is that you do not want to see the white spot anymore. If you can still see the white spot, you continue etching. I would say maybe 30 seconds. And that etching is continuous. You're going to etch until you see the white, until you can't see the white spot anymore. So you're literally etching all the way through the depth of the white spot. That is the idea. That is the goal. Again, this is a lot easier said than done when you're doing it clinically. The teeth are dehydrated. It's kind of hard to tell, but you really want to, you really want to be, using magnification. You want to make sure that you're looking at this, that you're drying well. That's why you have the Icon Dry, so that it absorbs within the enamel, and you dry as best as possible. And the idea is to obtain what you see on the left-hand photo. You can see that on tooth number 9, white is completely gone. On tooth number 8, I still have a little bit of white, so I most likely went ahead and etched a couple of more times until I didn't see that. But that is the idea. You don't want to see any of the white spot before you go on to the next step, which is applying the resin infiltrant. The resin infiltrant, the system comes with a very nice applicator. You saturate that with a very flowable, clear resin that you apply on the tooth and you stay there, you brush it on top of the tooth, multiple times. I would say for 30 to 40 seconds, because what you want to do is that you want to make sure that you saturate all this etch enamel so that this very fine unfilled resin infiltrates within all those micropores that you've created on that enamel. And then once you do that and you apply it multiple times and you make sure that you saturate it, you eliminate the excess, and then you go ahead and light cure. Once you light cure the first layer, you're going to apply a second layer, because as you know, you're going to have some oxygen inhibited layer on that final layer. You want to make sure that you cover it as much as possible, and then you go ahead and light cure a second time. So each layer is cured separately. The first layer is the most important one. That's the one that you really want to take your time, 30 to 40 seconds, saturating that area multiple times, just making sure that it's absorbed, that the unfilled resin is absorbed in those micropores created by the acid, and then eliminate the excess, light cure, apply a second layer, and light cure again. Once you light cure the second time, you're going to go ahead and you're not going to polish a lot. I'm just going to use a medium and fine disc, or fine disc, because all you want to do is just make sure that you eliminate any areas that are uncured, and you just want to make that area nice and shiny. So you don't want to remove what you just accomplished. And this is what the surface should look like immediately after applying the resin infiltrant. As you can see, there is no more white spot left. This is immediately after, so the teeth are still dehydrated. But once they rehydrate a couple of days later, I would probably say a follow-up in a couple of weeks, I have the patient come back, and this is the photo. This is the photo of, maybe 30 days after I completed treatment on her, and you can see that the white spots are completely gone. There's no remnants of the white spot, and this is exactly what she was looking for. She had a beautiful smile already. Her teeth were nice and light, and you can see that the treatment is effective. But again, the idea is that you select the right treatment option for the case that you have in front of you, and most importantly, that you understand that some of these cases may require a combination of all three modalities. You just have to make sure that you understand which one would start first. And just to close today, before we finish our webinar, I just want to make a summary of this. So again, first and foremost, diagnosis. Is it a white spot because of ortho? Is it just a white opaque hypomineralized area that is now shiny, or is it dental fluorosis? And if it's dental fluorosis, what is the index of that dental fluorosis? And then once you know exactly what's going on, then you go ahead and you have these three options. And depending on the opacity and the size of the lesion, of the white spot lesion, that's what's going to determine what goes first. In my personal experience, and my recommendation is, the larger the spot, the more opaque it is. I would definitely start with micro-abrasion, followed with bleaching using 10% carbon peroxide, waiting 15 days after bleaching to reassess, and then if needed, resin infiltration. If the spot is a small spot, it's not that opaque, there is no staining, the enamel is nice and smooth, then you can go directly into resin infiltration, or you can start with bleaching 10% carbon peroxide just to reduce as much as you can the size of the white spot, and then follow that with resin infiltration. If you have pitted enamel and if you have staining, well, the most important thing to do is you want to get that abrasion effect that you only get after micro-abrasion. So again, start with micro-abrasion, then move to bleaching, and finally, if needed, resin infiltration. Thank you very much for your time. I hope that you enjoyed this webinar, and please don't forget to ask any questions you may have through our YouTube channel, or email me directly at romerodentalseminars@gmail.com. Thank you and have a great night.